that lead a person to that point to begin with. Those root causes will differ from individual to individual, but can include a lack of affordable housing, an inability to access services, and insufficient supports that would keep them within the social safety net. Most of these are not causes the city can solve on its own. We can only alleviate the symptoms of the root causes of these issues, not eradicate them. How does the Downtown East Action Plan help alleviate the symptoms? To be more precise, we followed a process that included consultations, a review of the effectiveness of the original plan, an analysis of best and promising practices, and the development of a monitoring framework. Based on this process, the 5-year action plan we know today was developed and 4 central outcomes were established. They are safe and inclusive communities, cross-sectional trust and collaboration, stability for marginalized people, implementation and accountability of plan. Although these central outcomes were useful in addressing some of the symptoms, the implementation of some of the coordinated services were not as effective, therefore impacting the overall success of the plan. The COVID-19 pandemic especially exacerbated the issues of them, was supposed to mitigate. City staff were also redirected to other high-priority projects to address the COVID-19 emergency response, such as the hotel shelter programs and supporting Toronto public health. As the effect of COVID took its toll on the public realm, such as increased graffiti and vandalism, and the effects on individuals such as increased social isolation, a lack of accountability between corporate and community partners, also exacerbated the issues. This brings us to where we are today. To ensure that DEEP is meeting its core mandate, city staff and our office conducted various engagement sessions with the community, holding a roundtable style discussions in 2023. We also conducted the Safe and Inclusive Neighborhood Survey to hear more about how community members feel about safety in their neighborhoods. Daniel will speak to the new Reset DEEP that is coming to committee and council next month. However, these are the recommendations that I have made based on the engagement that was conducted and feedback that was collected. I have made recommendations for each of the 4 central outcomes. Let's touch on them briefly. For safe and inclusive communities, my recommendations include creating a clean streets team with outlined services levels that will provide enhanced cleaning services levels for streets, sidewalks, and laneways, and waste on both public and private property. Offering enhanced cleaning services levels in parks, establishing a cost-sharing grant program for glass window replacement for small businesses within BIA catchment areas, supporting community engagement teams to address social disorder in BIAs like the Cabbagetown BIA and the Church Wellesley BIA, providing training on mental health, overdose prevention, suicide prevention, and de-escalation to frontline city and community agency staff. Identifying opportunities to provide access to safe indoor and outdoor spaces for marginalized people. Increase capacity for parks, forestry, and recreation. In-house, we call it PFR, and our staff are here today. And library staff to accommodate marginalized people. The creation of a dedicated Clean Street team to deal with garbage on public and private property, harm reduction, waste, and human excrement. I have also recommended to community engagement teams for both the Church Wellesley BIA and the Cabbagetown BIA, similar to the community engagement team located at Sankofa Square. Issues at Sherburne and Dundas and the village are very similar to those we see in the square. So it is only fair that they are afforded similar resources to deal with these issues. My recommendations for cross-sectoral trust and collaboration include creating a service providers network for the Downtown East, requiring good neighbors policies and community liaison committees for community service providers, establishing accountability and reporting mechanisms for service providers, restructure the Downtown East leadership table, supporting existing community safety networks and establish new ones if necessary, establishing accountability and reporting mechanisms. My recommendations for outcome stability for marginalized people include continue developing a Dundas-Sherburne Community Development Plan, continue to prioritize the Downtown East housing strategy to create more affordable and supportive housing opportunities, including George Street revitalization and the revitalization of the Dan Harrison Community Complex. Develop and identify funding sources for the creation of the Community Improvement Plan for Moss Park. Work with city and community partners to implement recommendations outlined in the Our Health, Our City mental health, substance use, harm reduction, and treatment strategy, and the Toronto Indigenous Overdose Strategy. Piloting the Community Outreach and Response Program, which we will refer to as CORE, a new outreach pilot project presented in collaboration with Toronto Public Health and Toronto Police Services, led by the nurse practitioner. And that's coming to effect very shortly. And we're very hard on that project. Provide funding to local food banks, teaching kitchens, and other initiatives in the Downtown East that combat food insecurity. Work with city and community partners to identify appropriate locations within the Downtown East for free permanent automated public washrooms that is open 24/7, 365 days a week. And finally, my recommendations for the central outcome for implementation and accountability plan includes reorganize the Downtown East Action Plan under the Community Safety and Wellbeing Justice Center unit within the Social Development Finance and Administration Division. Provide adequate staffing and resources to support service coordination and plan implementation, including a 1 full-time position. Establish systems and processes to ensure 311 remains the central number for all service requests, which includes accepting and triaging requests to the community safety teams and clean streets teams. Creating a web page on the city's website that is updated regularly. This website should provide centralized resources for members of the public, community stakeholders, service providers, and information about the implementation of the plan, including the public dashboard and other public accountability reports. Creating promotional materials to promote the Downtown East Action Plan and its funded initiatives. Ensure that all initiatives and services funded through the Downtown East Action Plan prominently displays the City of Toronto's logo and recognizes the Downtown East Action Plan on all documents and promotional materials. Create a public dashboard to track key deliverables, service levels, and outcomes of the Downtown East Action Plan. Provide quarterly reports from the interdivisional data tool to the Downtown East leadership table to inform response to public realm concerns in the Downtown East. Report to the Economic and Community Development Committee regularly on the progress of the Downtown East Action Plan. That was a lot of information. I understand that. Now we will hear from Daniel Bondi, whose team is preparing the downtown action plan. And I'm sure he will take questions after that. So, Daniel?
Good evening, folks. It's great to see some familiar faces. Exactly. Love the energy on a Wednesday evening, on a beautiful day. You guys could be anywhere in Toronto, but you're here, which means that you care deeply about this work, and we're thankful for that, because so do we. And so, before I go into just a little bit of the background, I do have some other colleagues who've joined me who are going to help in this presentation, so you don't have to listen to my voice through the entire evening, so you'll be thankful for that. But I see you also found a picture of me somewhere, but maybe you got my good side. All that to say, the Downtown East Action Plan is a really good encapsulation of how the city comes together to solve complex problems. And so if you work in a city division that is supporting the Downtown East Action Plan, maybe you just put up your hand. If you work in and staff are helping coordinate and support the implementation of such a complex plan to solve such complex problems, right? And so we brought them here to help inform some of the questions, or if there's any thinking that might need to happen as the dialogues at your tables go on, we're going to be floating. And so if you have maybe a specific question to parks, shelters, public health, we've got experts in the room that might be able to answer some of those questions for you, okay? Which begs the question, what do we do at SDF&A, at Social Development, Finance Administration? We help bring the divisions together. We help coordinate, we help monitor, we help evaluate, and we help overall implementation. But we really do lean upon the strengths and the expertise of our other divisional colleagues to do that. So that's why we don't travel, we don't leave home without them. So I'm glad that they could join us, and I'm super appreciative of them for coming and joining this evening as well. And thank you for the opportunity, councillors and council staff, to help present this. It's an exciting milestone in the implementation of the action plan. We're 4 years in, 5 years in, and so we find ourselves at a moment, like the councillor said, a moment of, and we've done that. There's been consultations that have done that. Maybe you've joined one of those cases. I hope that you did. But we've taken that, we've listened well, we've listened as well as we can. Moments like this, moments like tonight, are spaces where we want to make sure that we heard correctly. And so the conversations in your table are going to help unpack that exactly. Did we hear correctly? Was this appropriate? Was this response correct? Is there something that we missed? And so please do jot that down, note that. Maybe while you're hearing some of my colleagues give presentations as we look through the kind of high-level flyover of the action plan, if you have a question, jot that down. We don't want you to forget it. And we don't want to forget to hear it when we listen for feedback. So I'm going to soon turn it over to my colleagues to help do two things. First, we're going to do a little bit of a re-listening exercise on where we came from over the last year and a half. There's been engagement, there's been consultation. What did we hear? What did we learn? And then there's another staff that they're going to introduce themselves accordingly, so you can hear from them directly. They're going to walk through the action plan in a little bit of a summary form. There's over 30 different actions that involve over 15 different divisions of the City of Toronto. We're not going to dive deep into all of them, but you're going to hear a little bit about the themes that emerged, the content and the context behind those actions. And so please do jot down your questions, your ideas, because we want to capture those as we incorporate that into the thinking for our go forward. All right?
Well, I got a question.
All right, I'll take one question.
What? Okay, Chris, what we're gonna do about 230 Sherbrooke?
Maybe we'll get to that in the slides, and so
Yes.
we don't want to steal the thunder.
Yeah, let's get through.
All right. So we'll take questions after or as you go through your groups. I know there's facilitators that are ready to listen and help bring that discussion forward. So we lean on them. And if you need it, just throw up your hand. You know where to find me. I look like the picture that was on the screen. I also look like this. I'm in the room. All right. With that, maybe I'll invite Bianca up to help do a little bit of a recap of where we've come from over the last 4 years and some of the themes that have emerged as a result of the conversations that took place last year.
Yeah, thanks Daniel, and thanks again for the opportunity to share with you some of the work that's been happening and where we're going. So, next slide. So just quickly to define what the Downtown East is and where it is. So the boundaries that we're defining for the Downtown East, from the north it's Bloor Street, to the south it's Front Street, and from Bay Street to the Don Valley Parkway. Some of the key, the Church Wellesley Village, as well as Cabbage Town and Kitchen Park, amongst others. Some background and context. I know Councillor Moy has already shared a lot of this with you, but the Downtown East Action Plan started out of an idea in 2018, which was a short-term 12-month action plan to address some of these core issues, which then became a 5-year action plan, which we're now coming to the completion of. And again, there's been a lot of consultation with different community groups. A lot of engagement was led by Fred Victor, the Quaywalk Naki Collective, as well as the Two-Spirited People of the First Nations, to provide us with a lot of feedback, what's been working well, what can be improved, and we'll share some of those insights in the upcoming slides. Again, you've heard what the central outcomes are. We want safe and inclusive communities, cross-sectoral city response to complex issues. So if this is successful, how can we replicate this in other parts of the world? Just some interesting facts for you all. So defining what some of the social needs are in the Downtown East. So just this past April, they identified almost 11,000 people are experiencing homelessness in Toronto. We don't have neighborhood level data, so that's 11,000 people across all of Toronto. But specifically to the Downtown East, we do know that there's 23 service locations offering shelter or services, and these locations provide almost 1,700 shelter beds. As well, 211 do provide a range of supports to the community. I think we're all familiar that the drug toxicity crisis does continue across Toronto, Ontario, and Canada at large. Over the past year in 2023, paramedic services attended to over 4,500 non-fatal and sadly 288 fatal suspected opioid overdoses. And the 2 neighborhoods with the most calls were Downtown Yonge East and Moss Park. And then just interestingly, the use of 311 services, some of the top requests, there was 118 requests for cleanup of litter in laneways and over 300 requests for cleanup of needles and syringes in the Downtown East. Just speaking a bit to equity and inclusion, the Downtown East Action Plan is intended to make positive changes for different groups of people who may experience unfair treatment in different capacities. This includes Indigenous peoples, Black residents, and others who may experience marginalization. Again, these changes aim to help with issues from affordable housing, access to mental health supports, job opportunities, as well as the Action Plan funds initiatives that supports addressing barriers and addressing gaps and needs to accessing different types of supports for different community members. And just sharing, there's quite a few strategies happening in the city. The Downtown East is just one. And because there's so many themes that feed into the Downtown East Action Plan, there are complementary strategies that do support the plan. So we have our Indigenous Affairs Office, there's the Confronting Anti-Black Racism unit, as well as the Poverty Reduction Strategy and Toronto for All. So speaking to some of those funded initiatives that are very active in the Downtown East, we have COAST, which is out of the Regent Park Community Center. It is a low barrier outreach for services for individuals experiencing barriers to supports. Originally it was out of the Dundas and Sherbourne area, but since January of 2022, it has expanded to Church Wellesley as well as Yonge and Dundas. As well, Here to Help is another great service out of the Gerstein Crisis Center. They provide very timely de-escalation and crisis intervention. If you give them a call, they usually have, they're responsive within about 20 to 30 minutes. And they're primarily in the Dundas, Sherbourne, Moss Park, and Church Wellesley areas. And then through PASAN, there's the Community Cares Harm Reduction Cleanup. PASAN provides peer employment opportunities as well as training on safe disposal. And if you're not familiar or you're not comfortable doing safe disposal, you can call PASAN and they can come help collect harm reduction items across the Downtown East. Okay, so let's talk about what we've done over the past 5 years, what we've heard. So here are our key learnings. So there have been successes, there have been improvements, but there are still lessons and opportunities to continue to do better. So things we have done well: collaboration with decision making. We formed different collaborative tables, different parts of the city, as Daniel had our friends raise their hands. There's lots of different people here from different parts of the city. We're working together, we're talking to each other, we facilitated new partnerships, and we share information respond to problem solving, and just work together better, because again, a lot of these initiatives align with each other, work together, so making sure we're all communicating and knowing what's happening with each other's programs and projects. Keeping people involved and to build trust and awareness, so this is an excellent opportunity. We want more and more engagement with all community partners, including grassroots groups, smaller agencies, and we want insights provided into what the local issues are. So your feedback, your insights are really important to this process. How do we make plans fit together and do more? As we said, there's all these different community, city initiatives, and how do they support each other, and how can we leverage these opportunities to maximize their impact? So again, an example is the Dundas-Sherbourne Neighborhood Revitalization Plan. That's a big project that's happening within the downtown east. Another learning was finding solutions for some of these big challenges and service gaps, so something we continue to work towards. How do we centralize our outreach efforts, create one point of contact? So similarly, there's all those funded initiatives, but they're from unique organizations that work outside of the city, like the city organization. So how can we better coordinate all those services and make it easier for community members to access those resources? And importantly, sustainable program funding. Again, once you have something that's working well, in order to sustain it, we always need program funding to keep those opportunities. If it's working and it's working well, how do we sustain that? Similarly, coming back to all the different initiatives that are happening in the city, so this is just an opportunity to highlight a few more. So from Health is our Health, Our City. There's also the Reconciliation Action Plan towards Truth, Justice, and Reconciliation. We have the Confronting Anti-Black Racism Action Plan, as well as SafetyO that provides a lot of supports for community safety and well-being. And we have the Toronto Community Crisis Service. Hopefully everyone's familiar. This is an alternative to police response to non-emergency mental health crises, and it's a great service instead of having to call 911 or those supports. They've been very active in their role. So just expanding a little more on what the engagement has looked like into the new iteration of the plan, the Reset. There's been a couple different public surveys, one led by Councillor Moise's office, one led by the city for the action plan itself. We've had a number of different focus groups and interviews, part of those consulting organizations that help do the public engagement. We've also held a validation session just this week with our Lived Experience Advisory Group, many of which are here with us tonight, so thank you. As well as Indigenous engagement, there's been quite a few different meetings and opportunities for Indigenous input into the action plan. So if I can now call up my colleague Miriam, who will speak to what's all that consultation, where all that has led us. Thank you.
Thank you so much, Bianca. Yeah, so quite a few people at the city are working on this. So my name is Miriam. I'm also part of the Social Development, Finance and Administration team. Bianca earlier mentioned that there are a few, there are 4 central outcomes of the action plan. So I'm now going to go over some of, they're just like in draft form, and some sample actions. And you're going to see that some of them do overlap with the actions that Councillor Moise had presented earlier, which is also a good sign that we are aligned on so many of the things that we want to work on. And just want to stress again, this is not exhaustive. So some of the actions that are focused on building safe, inclusive communities. We have continuing enhanced cleaning services levels. We want to provide, or the actions have additional support for marginalized people. And so these supports include funding overnight outreach programs. There are programs happening during the day, but we've really identified a need for more night programs, so that's something we want to provide funding for. And also providing increased access to safe indoor and outdoor spaces in public libraries and parks. Washrooms is one example as well. Some places are more safe. Other actions include providing supports for businesses for things like vandalism that they face and other concerns that they have in the area. And finally, support for community members and agencies. Things like providing more training and education so that communities and agencies have increased ability to respond to any situations that they encounter. And finally, a grant program as well, where resident-led groups can come up with local solutions for the problems that they're having and like really work collectively to address concerns that are coming up. Next slide, please. Great. And the second central outcome is cross-sectoral trust and collaboration. And my colleagues have mentioned this already, like there are so many different partners within the city and externally as well that need to all come together. So these are just like some actions. So for example, with community members and sector partners, we need to be really clear on what are the resources available, what are the services available. Again, developing a good neighbors guide, as the councillor mentioned, to really have key information on what we can all do individually and collectively to improve the area. And then for the funded initiatives, we have, Bianca mentioned 3 funded initiatives working in the area. We want to make it easier for them to tell us like what they're doing, so we want to really standardize the reporting system and have a way to see, okay, like where is the work happening and what are some areas that we can focus on and improve. And finally, working with the Ontario Health team to improve health and mental health outcomes. Now we have the third central outcome, the stability for people experiencing marginalization. So this includes having Indigenous specific engagement approaches. We've mentioned engagement with them in the past, but really want to have continue to have engagement and have actions focused on the Indigenous community and the agencies as well. And then we want to have more actions focused on improving housing outcomes, right? Improving mental health, substance use, harm reduction, treatment, like those focused around those outcomes as well. We have Dundas Sherburne Neighbourhood Revitalization Plan to really be able to focus in on that area and make sure it's getting the attention it deserves. And finally, our last outcome here is a model for a city response to complex issues, or like really just focusing on implementation and accountability, how we can make sure we're learning what we need to from the area, and making sure we're communicating with everyone effectively. So we have one of the actions is around communication strategy, including a public website, so that the public can know like what are the initiatives that are happening, have updates on updates that are like a bit more frequent on what's been going on, just so people can stay informed and be aware of the work that's going on. And similarly, there's a dashboard that has the initiatives, what's being done, and like really help us identify, okay, like what are we doing well, and then where are some of the areas that we need to improve on. Thank you so much. I think that wraps it up from, I don't know if I want to do a nice ending, or...
I don't have any poetry.
Okay, no nice ending from Daniel, but I will say a thank you and pass it on to the councillor. Thank you so much, councillor.
Thank you so much. Thank you. This was very, very helpful. So based on what you've heard a lot here today, but based on my recommendations, plural, and based on what staff has shared with you today, we're going to ask you to break out into different groups, and perhaps you could add to the conversation. Anything that we may have missed, please share it with each other, and we'll have people at each table. We'll break out for about 30 minutes, and then we'll come back and regroup, and you could share what each table will have to come back with. So let's do that. Okay?
Quick question, will these slides be available on your site?
We can make them available.
Yes, please.
Okay.
Thank you.
A lot of information.
Thanks so much for coming. Yeah. Well, I'll make a special note to say thank you.
Yeah, I heard that they want to do a pilot thing. To tackle white collar crime, but I don't know what it is. It's not happening because of the supervised. That's a condo one. That's white collar crime. So we make it difficult to look for money. I'll pay you some money. This is what they're wrong.
We just say, we know that that's the same for our government.
We put up with a lot of
With the surveying team, how we can sleep, the surveying for some scratches on the road. And then they just put this in the middle of the plant, there's a bush of flowers, and they just, it's like, not in rosemary. That's how they do it on their own. It's the same fruit, but they don't do it. That's not health, that's not necessarily health. That's just some snapshot. East side, downtown. City.
So they said that there was
Nobody comes
we got an email exchange don't feel safe when they say the vehicles don't feel safe when you get out of here. How do you think the rest of us this is a constant issue that we have in the valley. There are clients we do get snow removal.
Hey folks, if you haven't gotten to the second topic yet, please move on to the second topic.
But I mean, if you guys where to get it done? Yeah, tell me where, no list of like if this code here, if this code here. There's just some like kids where they just don't, they can't find it's not just like a little bit, it's like there's only like a sharp sword attached. It's not good.
In front of the grade school.
Yeah, public school, you know.
We want to get those done.
I'm not sure that it's very confident because it's optimistic.
We also have.
Absolutely, absolutely. That's our other concern, that it's behind public school, and it's really, like, I don't have kids. I have kids. Because I bring in and
Very tall order here.
and I know it's complex. I
Most of the songs, we just, the other neighborhood email group, we just schedule, okay, next Friday or next Saturday, we're gonna go, and we're gonna go with the academy.
some of these shirts.
And then we put it some amendments done for just called the city, saying we moved it all into a pile next to the road. Can you come pick it up? Because these are, at least when we move it to a pile, the names our garbage is covered.
And also know that we have to buy them. So we have to say, oh, this is a because we say, as a community, unless it's native people, unless it's that, we have to say, just show up. If we say, no, it's like, well, then it's not really garbage. Go buy a car. This is not a put it someplace specific, it's not, it's covered, it's on school, it's private property. So we move it, we lie that it just showed up, and then it gets moved up. But I mean, that's just works for us.
We've been doing it for years.
Years. It's big enough for the stream. You know, effective-ish. Yeah, but it means it also oversees. That I feel like that was the annual but it's on the sidewalk, it's yeah, exactly, or a path.
Groups need to have collaboration. All I know is what I do.
Okay, folks, time to move on to the next topic again. The next topic is stability for marginalized people.
that tree will just fell. You see that thing just
So I think that surprises me that it was just the number of persons that was that area. Yes, if you don't know that, how can you put the funds and support to the right area if you don't know to be able to direct funding and support is
It makes sense.
I don't remember. I mean, who knows? It's quite big, but I think it would observe.
I'm sure you want to use it. You can't hear it on second. You can't report 1990. And then in 2018, the first transaction what can we do? Then, 5 years later, we're still, what are we going to do? Right? So I understand it's a lot of processes. It sounds a lot like kicking the cans out now. Once again, and then by 2030, the next step, where's the I'm sure if they did simple investigations of all the other houses, they'd probably find similar issues. Domino all the other cheers. But not, it's not going to happen. What's playing this?
It's hard for coordinating services when you don't have it'd be great to I just wanted to ask a question again. But I think that they gave some of the work. Obviously, if we don't have office, we all but the only way to actually do it, you would know that it's really big,
Well, we look forward to these reports.
That's why we're saying funny during staff. But
it's also very
well, we're waiting with data.
I think this is your favorite, right?
There's like a we don't know how much there is.
What I can tell you from the issues they were like
it's there. I would ask SDFA, Provider Revitalization.
Okay, if you haven't already, switch to the final topic, implementation and accountability.
Making a lot of money. Yeah, well, I don't
I think the work has been done. The paperwork side.
Well, you're an advisory, so it's first you're the advisory.
And we're paid.
Will this round get more money than the previous? By like
Okay, facilitators, if you could start wrapping up.
And again, that's because you're suggesting if you have a residency, let's say you need to go out and show us
There's a lot of overlap in the
You're pretty connected. You seem like you know what's going on and things. I know that and it's like, and a few people come by. It's like, oh, is that for this plan? It's also this kind of thing.
Where exactly is it? That's called team.
Yeah.
And they're both going to pick up both plans from both guys.
And it seems like that, you know?
And even when I doing one like for the same problem, they give cheese on the one is they take care of it, and then there's all this other one where they're and then none of those gets it.
Alrighty, folks. I think we're good to go. I'm going to ask. Alright, let's get back to our regular tables. And I'll ask the table leads to come up and present. All right, thank you everybody for sharing your thoughts with our team and city staff. And so I'll ask each table lead to come up and summarize the remarks from each table. So, do you want to start?
Is it over here? Or they can answer over here?
Yeah, sure. Thank you.
Okay, so I'm going to get us started with some thoughts and questions from the table that I was at.
Yeah.
So there were a lot of questions about the different teams that operate within the community and the different services that they provide, such as the community care team that's led by Hassan. So I think there's room for maybe better communication with the public about these various services. I know that the Toronto Community Crisis Service, that's been very well publicized, and there's been a lot of education around that, or maybe we can help some of our other partners with better communicating the services they're delivering. And also in terms of communication, there are some concerns around internal communication and consistency. For example, calling 311 and 311 is not knowing where to direct things sometimes, and you can call 311 twice for the same problem and you're going to get completely different answers. So there's room for internal work there. In terms of some questions, there were some questions about metrics and when we can expect to see metrics, I guess, from the plan that's wrapping up, and then also when can we see new metrics?
Thank you for those comments and questions. And when we do have people taking notes, and I know there's people at the tables who took notes as well, so we'll be collecting those. So just because you don't see me taking notes, don't feel like we're not listening. So just wanted to name them. But sorry, what was the metrics and communication, right?
Yeah,
or metrics. Yeah, great question, and that's something that we've added in actually new, wrapped inside of it. There's obviously the action itself. There's key partners, divisional partners that need to implement that, outcome measures, as well as hard targets that have been established. And the hard target one is new. We've added that for this phase of the action plan. And so those are going to be seen when we release the report and when it's publicized. And so keep an eye out for that, because I think that will address some of the kind of quantifiable, metric-based, hard target-based language that we know is needed.
What does policy look like, and who will it apply to?
That is a great question. And one of the things that we have heard is that policy is needed. And so it could include living rough that night. That neighbor might be someone who's next door to you, who might have a needle in their yard or a scrap in their yard that needs to be picked up. It could be a how-to guide, it could be an information guide, it could be a community building guide, it could be a resource tool, it could be many things. And for example, there's a number of neighbor guides that a city has. Some are specific to different projects. This one would obviously be specific to the Downtown East action.
And just a final question would be, some of these issues have been identified maybe 10 or more years ago. And there have been numerous reports, things like that have shown that these are challenge areas, and yet going to see action around this, and it's not going to be pushed for another 5 years.
Great question. Yeah, no, it's. I think we need to take comfort in the fact that small progress is still progress, and not assume that this action plan is going to be a silver bullet solution to all that you find yourself living, working, or playing. And so, just aiming to take a measure of good hope and good confidence, but also, recognize that these are big, complex solutions that require long-term thinking, not just from us in the city, but also from our partners in the provincial government and the federal government. When we think of housing, when we think of mental health, when we think of homelessness, when we think of substance use, these are complex problems that require multiple different levels of government, multiple different institutional partners to come together. And without that, we will only see small change, but that change still means that there is a better today than there was yesterday. I don't know if the mic is. It's okay. I have a booming voice, but I need to turn it on.
And that just about wraps up everything that my table talked about. I would like to invite Mary to present her table side.
Okay, so my team, or teams or tables, I guess just tables, but so we had a lot of discussion about different parts of the plan, and a lot of suggestions came from our table. One of those suggestions is that we should also have an action plan on, white collar crime, and that the police should also focus on, crimes in the financial sector instead of just kind of like the low-hanging fruit that we see enforcement usually happening around, and that this could fit into our plans for the action plan for the confronting anti-Black racism. We also talked about having bigger garbage cans, bigger, more robust garbage cans and servicing them more efficiently and more often. Also having consistent enhanced services in streets, laneways, and parks. So just making sure those enhanced services are actually consistent. We also talked about activation of public spaces, like having electricity in parks, similar to like St. James Park, for example, has like a pavilion where you could put in an amp and have a concert, for example, and having something like that in Anniversary Park. And then we also talked about identifying, community space for coordination tables, like a service providers network, similar to what they have in St. Jamestown. So lots of things we discussed and lots of asks, no specific really like questions, but I guess if you could talk about like activation of public spaces, I guess, and how that, fits into the Downtown East Action Plan, because that's one thing that we talked about a lot at our table.
You want to start?
Yeah.
I know that Parks is here. We had a conversation this afternoon about something went up. Well,
thanks for putting me on the spotlight.
I can say a couple words. This is not to her.
So the question is activation in parks?
In public spaces, but I guess specifically parks, yeah.
So I think this is something where we rely on community members tremendously to help us with this. Parks aren't meant to be open spaces, they're meant to be safe and welcoming spaces for everybody to use. We want to see really parks being used with active and passive recreation. So people walking through them, taking their dogs out for a walk, taking children, using the playgrounds, using the sport facilities, whether it's a basketball court or a tennis court or any type of amenity. We strongly feel that the more parks are used by people that live in the neighborhood or people that are coming into the area, then the safer the public spaces will be. And to help you with that, we do have a team of staff that's dedicated to the Downtown East area, where we try to pick up sharps and hazards and things like that during the visit or submit a complaint about a needle in a park. If you provide details about that, then that information gets relayed quickly to the staff and they get dispatched. So, I turn off my phone at some point in the day, but we do have a system where 311 relays that information to what we call our Parks on Call. And they make sure that the staff that are working till 10 o'clock at night can go out, and that's 7 days a week. So, keeping our parks safe for everybody is a really high priority for us. So we go out and about, and we have our parks ambassadors that go out and about throughout the city, and their job is try to connect to people that are in the parks. So if somebody's living rough or somebody's setting up an encampment, they try to connect with them, and often they'll make that first referral to the different street outreach services and agencies. And our parks ambassadors work throughout the entire city and not just in the Downtown East area. But they're a very responsive team that works Monday to Friday, 7:30 to 4 o'clock. And our final team that we have is a special parks encampment cleanup crew. So this team of staff works in parks, and they actively clean up in parks where we have encampments. They are often helping people pack up their belongings when they accept shelter and they go inside. So you'll see them out and about in their high vis working in the parks to try to keep the parks as clean and as tidy as we can. And we've given these staff teams additional training on de-escalation and working with people with addictions and mental health issues. They're a really solid group of staff. So those are some of the ways that we try to make sure the parks are safe, but in truth, we rely on all of the community residents to use the parks and keep them busy and as active as possible.
So I have a follow-up question. How can community groups then, activate these?
Welcome to come to a park and use a park whenever they want. If you have a group of more than 25 people and you want to have it closed at 12:01 a.m. till 5:30 in the morning, outside of that, parks are welcome to be used by everybody. If you have a group of 25 or more people and you want dedicated and specific access to an area of the park, we do that. And I believe through SDFA there are community grants where different agencies or different community groups can get funding to create special events and community events where the community comes together, and dependent agencies and for community groups in an effort to make this very accessible to everybody and for money not to be a barrier.
Thank you so much. So that wraps up my take.
So I think in our table we discussed a few things. There's three main topics that we discussed about. Some of the issues that are plaguing our city, such as trash and waste and stuff like that, and they feel that the city itself should be monitoring the streets more rather than relying solely on 311 and resident complaints. And I think another, I think one of the staff members said that large streets, like arterial streets, are cleaned once per day, and we did not know that. The second question that we had that I think is important is, somebody asked me why the issues, that question, staff or Councilor Moise or anybody?
Thank you, Stanley. So historically, 62%, I believe, of social services have been Toronto-centric, right? It's always been the hub of social services and also places to stay. But that responsibility has been delegated to staff to actually find housing and services throughout the city. So that has been changing slowly. If you look now, there's a lot of hotel shelters, for example, in Scarborough and Etobicoke and elsewhere. And there's a lot more affordable housing being also built outside the city. But again, but now, here we are in 2024, and so we have to deal with the issues that we're faced with today regarding the refresh of the Downtown East Action Plan to try to deal with the very real issues of today around addictions, mental health, underhoused, and the results of all of those things. The Downtown East Action Plan significantly. As you know, the end of this Downtown East Action Plan pilot project will come to an end at the end of 2024. And the intent is that the refresh will start in the new year, in the new budget year, 2025. So again, if you look closely, this plan, what comes with it is a budget piece that is going to come to this budget cycle, which I've actually started internally, right? So again, a holistic approach.
Thank you. The last piece that we talked about, that I think is, that we talk about a lot in our office, is that we don't know who to reach. There's so many departments, there's so many of them, instead of being siloed in their specific divisions, I want people to talk more. I don't know, Daniel, do you want to talk about that?
Division has their speciality. Like, you go to a doctor, you go to a specialist that focuses in one particular area. So for us at SDFA, we are often asked all of the build up to connect to the right people in the city, the right divisions in the city, the right units inside of a division in the city to help bring that when really we are a brain surgeon. So we want to make sure that we're talking to the right people, and we want to make sure that we can help you. Part of the way that we're trying to help remove some of the friction that is involved in that is just helping inform the public through our website. Kind of a one-stop shop. And so there's ways that we have enhanced that website, which is toronto.ca/downtown east. And back and help connect you to the right city division, because we do have that network. We have it mapped out, we have all the spreadsheets and all the contact lists. And so we're happy to tag in the right division.
Thank you, and who's next? I think that's
Yusuf.
Yusuf.
Team member.
So we had a lot of this. How do we keep them clean, the parks? How do we keep them busy? Is there a way we can animate the parks that makes sense? So not taking away park space or redesigning them, but still making it accessible as open fields. instead of cut through path. We heard that parking is an issue, and we can't eliminate that fact. And is there any other way we can figure that out to have?
Start with the second one again.
How do we keep parks clean and busy and animate them in a way that makes sense?
Well, I think we've heard a lot about that.
Yeah,
If you want to host an event where it's how to pick up needles, we have Hassan who is happy to come and deliver that training. We've resourced in town. So.
And will you be providing the equipment, like the buckets, the tonsils, pickup?
I'd have to check in with them, but I'm just sure. If that's of interest to you,
Yeah.
downtown is at toronto.ca.
Can Street Help get involved too?
Yeah, we can reach out to Street. We're all good.
Alrighty, thank you so much everyone for participating. That's excellent. I love it. I love it. Are there any final burning questions anyone has? Want to share? I think I was walking around a lot of the tables, like, have conversation. Go ahead.
What are you gonna do about 230 Sherburne?
So that's the private property. That's the Kingshead property, 230 Sherburne. There is something available. So yeah, that's about that. What I can say about that. So I just because I don't want to say too much.
Holly, you better get up there.
So we are in the process of writing a letter along with the mayor's office to 235 Back.
Yeah.
Basically, the city has made their final offer to Kingshead.
Yeah.
As a city, we would love to acquire the property, but we're not going to overpay for it because then that jeopardizes being able to actually build on the property. Because we also need a letter will be made public, just so that the public knows where the conversations are at, and basically we're at the end. Like we're basically if they say no, it's going to be a no, and unfortunately they can do what they would like with that property. You know, earlier this year, for St. Michael's Hospital and for Sick Kids Hospital, that within the flight path, and so they had to bring their height down from where it is capped because of that flight path. So, you know, hopefully at some point somebody comes back to the city and says, okay, fine. But also keep in mind, like the city did bid for this originally in we got the property over the city, but now really the joke is on them. So.
Well, I think you said too much.
I guess the action plan was Toronto specific, but we have to make an action plan in terms of integrating and collaborating with provincial and federal levels of government to bring it all together.
Not of the actual around other strategies in the downtown core specifically. I can't go into any details because those are confidential, but we are having a conversation. I'll leave it there for now. Well, thank you so much, everybody. Andre, get fine.
Where's the works being moved?
Yeah.
That is confidential. That will be participating. It's lovely to have everybody here this evening.
Oh wow!
And before we leave, one more thing. So again, this is our third Toronto Centre Talks, and I'll continue to have them. But I just want to let you know that on July 13th, we'll host our Environmental Day in the Regent Park, the Big Park, 10 a.m. to 2 p.m. So I hope to see all of you there. So thank you again for coming out, and have a safe journey home.